and launched their institutional challenge. No worries. They designed their institutional challenge grant program, which supports research practice partnerships to generate and use research to reduce inequality in youth outcomes. She has, and the foundation have contributed so much in the implementation science space in trying to help ensure that what we know is what we do and really moving evidence into practice. So they're great, a great organization, and she's been such an important leader there. We're going to have her kick off and speak today, and then we will have time at the end for questions. So be putting them down, put them in the chat, and we will have plenty of time to come to your questions. All right, Kim, take it away.
Hi, thank you. First, I just have to say hi to Nancy Gagliano because I just saw her come up. And, some people you travel with spaces for 15 years, and when you see them, you smile. And so, hi,
I'm
Nancy.
excited to be here. Yay!
So thanks so much for having me, Kim DuMont. Before I start my slides, I just wanted to share a moment about myself and the foundation generally, and then we'll get into details. So I'm trained as a community psychologist, and so I very much think about how systems affect the well-being of individuals. I worked in a research position for many years, both in a medical school, actually, and then for New York State Office of Children and Family Services. And then I found my way into philanthropy in an organization that funds research, the William T. Grant Foundation. I was here for 9 years. I left to go start a funding apparatus at a research organization. And I did that for 2.5 years, and then I came back in the role I'm in now at the foundation. And so I care a lot about research, research that is respectful and relevant to the lives of individuals, and also to that knowledge is used in some way. So as you will hear, as I describe the foundation, I'm a good fit for the foundation in that way. I also wanted to say, I understand you all are an implementation science group, and I've tried to pull out some examples that intersect with implementation science as I speak to it. If you read our materials, we don't call that out. We don't go around describing or positioning ourselves as implementation science, but we fund a lot of implementation science work through the broader questions. There's also an essay that was written by Lauren Suplee and Annette Boas on the intersection between implementation science and research use, which you can look at if you want to try to understand how those things operate. But I think I tried to make that clear in my talk. So the way I'd like to proceed is that I've structured my presentation in 4 chunks. 2 about what does the foundation care about, what's our focus, and then 2 on different funding opportunities. And so I'll pause at the end of each of those chunks to take your questions. Please do to the chat. And as I call up my slides, it would be fantastic if in the chat you could just put a couple words around your research areas, because then I might be able to draw on other examples than the one that I listed. So with that, I will share my slides. Can everybody see those? Yeah, okay. So I'm Kim. I'm going to talk about our funding interests. But first, William T. Grant Foundation. So Mr. Grant ran a series of department stores. Many were in New England, so you may have known the Grant stores when you were younger or heard your parents talk about them. I don't know. I actually would go with my mom to the Grant store, and Mr. Grant was very interested in some questions about human nature, both in the selection of employees and an observation that some employees led very healthy lives and others were not on that path. And so he started the William T. Grant Foundation to better understand what would lead people to have and live more contently and peacefully. And so he supported, and in our charter is a commitment to learning from research. It was used to fund the longest study of adult human development, which is at Harvard, and following a class of Harvard students well into adulthood till 80 years. And Mr. Grant was also very interested in not just producing knowledge, but thinking about ways to use that knowledge. And you will see that reflected in our focus areas today. So all of our funding opportunities are organized around our focus areas. We have two. They're broadly described, and so understanding them is really important for then coming into a specific funding call. So the first is on reducing inequality in youth outcomes, and the second's on improving the use of research evidence in ways that benefit youth. And we support implementation science studies in both of those areas. And I will share a little bit about each. So in the reducing inequality spaces, we're interested in youth who reside in the US and are between the ages of 5 to 25. So in the US and between the ages of 5 to 25. And we are looking for research to reduce, so studies of programs, policies, and practices that reduce inequality on the basis of economic standing, race, ethnicity, immigrant origin status, and sexual or gender minority status. Those are our interests. They have been, and we're remaining in this space, even in the current political climate. And so we are particularly interested in academic, behavioral, economic, or social outcomes. New for 2026, it's never been a priority to focus specifically on health as an outcome. And I'll talk about that a bit more, but we have removed it as one of the outcomes of interest. So instead of a lower priority, it's not called out as an outcome. Although for many people will use physical health, and that's what I'm referring to here, physical health. We welcome studies on mental health as a mechanism en route to behavioral outcomes or academic outcomes. And so there's still a space for it within the portfolio. So what I find is most useful is to talk about some of the work that we have funded recently. And I like to do this for a number of reasons, to highlight the kinds of questions and the range of questions people bring to us, as well as some of the designs that we have funded. So these are just a few I put together in advance of this call that I think intersect in some way with implementation science. The first is an example of an effectiveness study or trial that you would do. It was built on pilot data, and they're now doing tests of efficacy to try to understand. So it is an RCT, and that's one of the pieces I want to go. It's mixed method. There's qualitative components to try to understand the implementation experiences of both those who are delivering the service and the young people who are receiving the service. I also want to call out here that it's focused on one place, Puerto Rico, as a way. Sometimes the studies are national in focus, sometimes they're place-based. So in that one example, there's different ways you can see that we might fund. In the second example, it's very specific, and there was a bit of attention in the proposal to thinking about how different implementation choices and fidelity might lead to better academic outcomes. It was focused specifically on Black students, and it was done in a large school district in California. So they weren't solely interested in impact, but a lot around the implementation process and the choices and those implications of that for the outcomes. The third study is an adaptation study, and that's the intersection with implementation science here. It was an evidence-based program that was in others, but it required a bit of adaptation to fit to the population that it's now trying to engage with. So this is national, multiple tribes, tribal communities, but the question is broader and national in scope. The third is more of what I would talk as a policy implementation study, and it looks specifically, but at the intersection with practice, and examines whether administrative barriers increase participation, the removal of administration barriers increases participation in school-based food assistance and thereby reduces food insecurity for low-income students. And so they're really using implementation science here and trying to understand ways to reduce barriers to access through the implementation of these programs. And the last one is a qualitative study. It's actually an ethnography to try to understand when there is youth participatory action research involved in an intervention meant to improve mental health outcomes for racism. What is the experience of Black youth? Does it change their perceptions of racism? Is it affecting their mental health? But it was a qualitative approach to those. So I'm going to pause at this point to take some questions if anybody has them around the reducing inequality focus area writ large and the kinds of questions you might come across. Great. So someone has a question around addressing chronic disease prevention in diverse community settings. So we do fund work on food security or insecurity. I don't know if your nutrition would fit there. You'd have to make a case that the physical activity or nutrition linked to a behavioral outcome or an academic outcome. So that's how it would fit within our portfolio. Thanks, Rebecca. Others, you can come off mute so I'm not the only one talking, or put it in the chat, or I can carry forward. Other questions? Okay. So as I said at the beginning, Mr. Grant was not only interested in producing knowledge, but also trying to understand how to ensure its use in efforts to improve individual lives. And we see that as an empirical question. For a long time, we fund research, and we can give examples when that work was instrumental or influential in setting a policy, in changing how something is practiced, but that's more retrospective and happenstance. And we wanted to invite studies for about 8 years of understanding how decision makers who sit in policy roles, so those could be at the federal, state, or at an organizational level, mid-level managers, people who sit in broker spaces or advocacy roles, how they use research evidence. And so we supported research, mainly qualitative and mixed method studies, a lot of case studies to understand those processes, the networks, how people engage, how they make sense of research. And we started seeing, if you would, almost a saturation of findings across policy spaces and across levels of policy around the kinds of conditions that supported the use of research evidence: trusting relationships, opportunities for debate and deliberations, influential nodes in a network who are poised towards knowledge exchange, culture or tools that reinforce or orient to research. And so we shifted our focus to then invite studies, examinations, or evaluations of approaches or strategies that foster more routine and constructive uses of research evidence, improving use of research evidence. And if that high quality research used, does it make a difference for us to youth outcomes? Here, health is welcome, nutrition, physical activity, physical health, it's welcome in this space. We're all trying to understand what are strategies for improving research use And does it make a difference when high quality research is used along with other kinds of evidence? What do I mean by research evidence? And the two that most of our studies focus on are conceptual uses of research evidence. So I'll take for an example, if we don't fund anything in this area, but in my mind, it's very salient. I'm coming from the child welfare space, and the introduction of harm reduction required a pretty conceptual shift for people to think about how they approach treatment. That would be where the knowledge base was helping people to understand not just the problem understanding, but different options for responses. And so it was really important to learn about the strategies that exist there and why it may be helpful, and also what the risks are for that. So a conceptual use. In the implementation science space, we see a lot of instrumental uses of research evidence. I have this challenge, or in serving young people, I'm going to call on an evidence-based program to slide into my SOT. So these discrete choices about how we provide a particular service, whether it's preventing substance abuse or anything else. So that would be a nice process. Uses of research evidence. We see fewer studies in this space, but I'm going to talk about one in a minute. This is where we call on the methods from research, so participatory action, a focus group, thinking about being systematic in our approach to something, and we encourage use of that process or that epistemology. Strategic uses of research evidence, we all do when we write a proposal. And you can also think about how there are strategic use to advance a policy, to make an argument, to prevent harm, many, many different ways for thinking about that. And so I thought it would be useful to share a few examples here of some studies that we recently funded that have varying degrees of intersection with what I think of focusing on the implementation process, or some of the questions that intersect with implementation science. So the first is actually from Harvard, is does a professional convening intervention. So you all go to your professional organizations, and when you meet there, they're proposed an intervention to encourage people to orient and to learn together. So conceptual uses of research evidence. We do that when we go and listen to a talk. You know, it either reinforces our thinking, provides new branches for our thinking, and then to see with the literature that's specific to school turnaround, whether there are possibilities that spring up, and there's a follow through and a study of that intervention to see if the leaders actually engage more with the research and begin applying strategies and understanding in their turnaround processes. A second is there's a lot of literature that exists around mental health treatment. This is specific to providing supportive services in schools for young people to engage in mental health services that are available. And this team has developed a suite of tools to orient clinical supervisors to the available research to help with problem diagnosis, the strategies that are available, and then they study not only the supervisory sessions, but also the therapist engagement with the young people. Oops. Elise,
okay.
I think you, okay. Thank you. Another one, oops, sorry. Another study that we recently funded asked the question. We had this literature, it was summarized by a national academy on state level technology use in schools. Now imagine if they had used this report prior to COVID, we might have been in a different place. It's been refreshed since COVID. So the use of the knowledge exists about strategies for providing technology and assisted learning in hybrid settings, and how do they get state leaders to use that knowledge. And so the proposal here is a research practice partnership that calls on peer learning with infusion of technical assistance to support the implementation of those strategies that are evidence informed. The last one is someone who holds the Mental Health Technical Assistance Center for sites across the United States in school-based mental health services. And they're designed their study and strategy to say one challenge that people often put up in the face of using research evidence, even when it's supported by randomized controlled trials, is that it was done somewhere else. It doesn't really apply to my kids. It doesn't apply to this place. It doesn't apply to the resources that we have. It's, and so they're using a discrete event simulation to try to model what it would look like and who it might affect and what the resources that are required if you took that evidence-based program and made it local to encourage use of the research evidence. So walking through and making the implementation more concrete for a local site. So I'll stop there to take questions. And I have one question, which is, I'm an infectious disease doctor. My research focuses on developing and evaluating interventions to improve uptake of services for HIV and other sexually transmitted infections.
Hi, this wasn't a question. I think you asked us at the beginning to put in our research interest into the chat, so a few people did that. Sorry.
Oh, thank you for doing that. Sorry. Okay, not a question. Oh, I see. People are putting their research interests. Thank you. Okay.
Kim, I have a question for you.
Okay, go
Can
ahead,
you
Karen.
say a little bit about how you guys think about evidence? So there's this perennial question about what constitutes evidence and when is evidence ready to be used. And do you have guidance on that? Is there up for debate in the reviews, or just say a little bit more about how the foundation thinks about that, if you would?
Sure. So what is research evidence? Well, research evidence, as I showed in the first set of slides, is in response to a lot of different questions. So there's research about people's experiences. That's often qualitative or survey, and we value that. There's research that's produced in a participatory or co-constructed style. We value that. There's research that is done to try to make claims around the impact of policy, which often uses quasi-experimental designs. We value that. There's research that comes from studies that are designed to make strong causal claims. We also see that. I would say that, so all of those are welcome. And how much research is available from those different sources to have enough confidence that we can use it, we should use it, we should be taking action. I think that's the more important question. So if you have a single study, are you gonna change the way people think about or behave or structure a system based on a single study? Probably not. And so, having a stronger evidence base, meaning more studies that are done well, regardless of, for each of the methods that they're done with it, because there are standards for each method. That's how we think about evidence. Now, the last thing I'll say about that is, we don't think that research should be used and everything else ignored. Research is used along a lot of different types of evidence. Data provides another source of knowledge. Individual experience, professional judgment, those provides additional types of knowledge. And so we see research evidence as being one of the sources of knowledge, that has to get integrated with those others. Sometimes they all align, sometimes they don't. That integration or that kind of reconciliation, it could be part of the process.
That's great. Thank you so much.
Yeah. Are there any questions? Sorry about reading people's backgrounds. It's questions. Okay. So I'll move on to, the last thing I wanted to say about the use of research evidence. We aren't trained in these spaces to think about research use as much, and implementation, science implementation is about using research in some form. So you all are trained, but this broader question about research use, we invested in an open access repository it's global. It has over 70 protocols that live within it that you're welcome to use to see the kinds of questions people are asking, how they see research use in documents, how they hear it in school board deliberations, how they interview for it, how they survey for it. It's all within this methods repository that's been created, and it's in its second iteration. My interface here might be a little old, so I'll have to fix that. So these two focus areas are the foundation, if you will, for all of our grants program. So in our research grants program, you can pick a study on reducing inequality. You can pick a study on the use of research evidence. You can try to integrate the two, but the questions that you center really should reflect one or the other area. So we accept letters of inquiry. Right now, we're taking them twice a year in early January and late July. And typically, projects are 2 to 3 years, and they range from 100,000 to $1 million. The $1 million is for the use of research evidence study. Often these involve organizational assignments. So you think about cluster randomized trials and you start getting large. Our indirect is 15%. So that's a lot of research dollars. It's not a lot of dollars for your institution, but it's a lot of research dollars when you think about it that way. In addition to the large grants, we have officer research awards. We take these on the same time frame, early January, late July. These are 5-page proposals and a budget. The first one, you just put in a guess. It's going to be $600,000. That's it. You don't have to tell us anything else about it. We're not making the decision on that. The second one, you have to provide a budget and budget justification, and it's your full proposal. And so we take these in January and late July. The basics are that while we have these broad interest areas or focus areas, the ideas from them flow from all of you. They're field initiated. And so our goals are to build theory and empirical evidence in these two spaces. Right now, and I'll say why, we have our invitation rates from a letter of inquiry to a full proposal is 8%, and about 20 to 30% of those are funded. For the officer research grants, you submit your letter of inquiry, 2 staff reviewers. We also work with 2 high schools, and the students review the ones on reducing inequality to represent a youth perspective about that's described in our guide. We then consider the rankings from the 2 students and the 2 staff in a joint meeting to make decisions about how resources are allocated, and we're funding about 8%. So I wanted to just share what we experienced last year. So this was before the inauguration in January 2025, and pretty typical of what we got. We received 50 officer research applications and 130 letters of inquiry. Fast forward to May, we don't take officer research applications in, but we received 440 letters of inquiry. In August, we received 150 officer research awards and 520 letters of inquiry. We're a staff of 19 total at the foundation. We have 9 people in program. And so we had to be clever last year, and we actually went through and took people who are very good researchers who were laid off to become readers at the letter of inquiry stage with us. So we were able to give some folks some income. That worked out well, and we're continuing with that process to complement our staff. We try to do 1-to-1, but there is a limit to how much we can read. We also reduced the number of application cycles this year to 2 from 3. So in January, we took in 7 Officer Research Awards, so that seems to be leveling a bit. And for the letters of inquiry, we took in 420. And then we'll have 1 more cycle this year. And so in essence, we're going to bump up the invitation rates because we'll only have 2 cycles. Whereas if we were spread across, it's just not responsible, we felt, to be exerting all this energy for so little opportunity. And then my suggestions are, first, make sure you have a strong fit with the focus area. It both has to have a theory. It has to add to theory or prior empirical work. For our foundation, I would say typically what we fund tackles a few questions quite deeply. And you also have to show the project's relevance for policy or practice. But we do believe that it's adding to a body of literature. So there's not an expectation you're going to go do a world tour with your findings from your study. So it's just relevant to conversations that sit in that space. We have to try to be as transparent as possible. We have annotated examples from successful proposals that exist, and these live live. They're publicly available so that you can go in, and the program officers have annotated them to highlight what reviewers valued. So these sit on our site, and they're there both for the reducing inequality and for the use of research evidence, and both for a mixed method and more quantitatively oriented study. So any questions about the research grants?
Can you talk to us a little bit more about maybe how you see the program changing in the next few years, like in terms of emphasis or anything else that you're kind of trying to be responsive about to
Sure.
make sure you're covering the gaps on? Yeah.
So for the reducing inequality, I expect very few changes, and in part because our stability at the moment is really important, that we continue to stand in this space. So I don't anticipate changes. We tried to change our process a little bit to be more respectful of people's times, but in the way we've done. But I don't expect anything else to change. For the improving the use of research evidence, the change we made from all prior years to 2026 is to put a priority on studies that investigate strategies for using research in highly polarized environments or around highly contentious issues. I will say, because I've read, how many have I read? I've read 100 of the letters of inquiry that have come in January, and oh my goodness, it's very exciting. This really resonated with the field to think about. We have this knowledge base and it's being lost in politics. How do we elevate, or what are the strategies for getting a full set of readers to engage with it? And that is, so that I expect will stay in, and then another set where you have issues that are more contested. And then the same kind of questions is how do you have, what strategies are robust enough to get serious entertainment of that issue? And so, so I think we'll stay there for a little while. We tend to stay in a space for 10 years plus, you know. Now here it's evolving a bit more, but that's what we felt was needed. We also launched a rapid response grants program. It's not open because we can't handle the volume. So people reach out with ideas, or in conversation, we'll hear about a policy window that's open. There's an evidence base that exists. We try to do a little matchmaking, and we invest in synthesizing that evidence. So, and there's a policy actor who can animate it and bring it to life. So we funded 4 last year. That's all we were authorized to fund by our board. But otherwise, I think we are just trying to stand where we are in that moment. Thanks for the question, Julie. Others? Okay. All right, I'll do the last segment, which is a scholars program. And our scholars program is an invitation to expand your expertise. It's for people within 7 years of their doctorate or their residency. It would be comparable to a K award, an SF Career Development Award, somewhere in that space. And that's actually when it started. It started when there were steep funding cuts at the federal government to career development awards, and born of that was the scholars program, which had a different name at the time. I am pleased to share that we have successfully secured another partner to join us this year, because we also received triple the volume for our scholars program. So we are going to fund a larger cohort than we usually do this year, because another funder came in with us. So and will stay with us for the next few years. So these are career development awards. Are 425,000 total for 5 years, the indirect 7.5%. And the idea is that you have a knowledge base that's in place. And let's say for the person who is studying nutrition and physical activity that's been primarily with adults, and you want to stretch to an earlier point in time, say early adolescence. And so that stretch might be that it's a new developmental space that you want to work in. You want to learn about the organizations or opportunities for leavers for in that space. That could be a different kind of stretch. It might that you've done daily diaries around the physical activity, and now you want to learn how to do qualitative interviews in that space. So it could be a methodological stretch that you're doing. Stretches come in different ways. You put together a research and a mentoring plan. So who's gonna guide you, advise you as you do that stretch in your career. And we typically see people put together 1 or 2 mentors. I am going to put a footnote here, because we learned a lot in July when we took in applications last year. This year they're due at the end of June, I believe. Is that in the federal funding world for career development, often your mentors are located on site. That is not the case for ours. And so this was a mismatch that became really apparent as we reviewed the proposals. So we think of mentors as we think of our Scholars Award is how does it add value to your career? And one way it can add value is to put someone else in your network that you wouldn't come across anyway. And so it's an opportunity to connect with someone at another college within your setting or another institution entirely. And so the committee members are asking, do they already have a well-established relationship? Well, then how does the award add value? It doesn't change that trajectory. So they're looking for how it might add. So I'd say that mentoring plan is a little different than what you might have done if you put in a K or an NSF career award. You have to be within 7 years, which I said, in a career ladder, just meaning there's an opportunity. You can be research scientists, senior research scientists, that would be career, as well as assistant faculty, associate faculty, so forth. We support the scholars through an annual scholars retreat. We have the Scholars Awards 5 years. So those 5 plus the new so 6 cohorts gather at that retreat. It's an opportunity to learn, put challenges on the table, and get your peers to brainstorm and problem solve with you. And then the final 5th year scholars also share their professional journeys in that way. And both the triumphs and the low points. So the proposals come in this year. I believe they're at the end of June. The guide's up on our website. It follows. You can pick the reducing inequality focus area. You can pick the use of research evidence focus area. Let's say you're an implementation scientist and you've really focused on the implementation at the point of practice, but you want to think about how do we get decision makers who allocate resources or make decisions about training and curriculum to engage with research use? Well, this is a stretch. You could stretch as part of your career development to study use of research evidence in this mid-level managers, or to make connections to advocates or state agencies or whatever. And so it starts internally, where you have pretty detailed abstracts, so take care with them. They get reviewed internally, and we have to make some decisions. We expanded our selection committee by 8 members this last year so that we could move more proposals forward to get a full review. So 2 committee members read those reviews. I think they invited 11 finalists in. The recommendations will go to our board next month. And then once the finalists are selected, their proposal also goes for external review, and you come for in-person interviews. We have to work out some of the challenges of it's different to interview in a room with 11 than it is with 22, for example. And so we're going to figure that out next year. Typically, we make 5 awards. As I said, I'm pretty hopeful that we'll be able to make more than that for the next few years. So what are the kinds of questions that people are asking in this? How can a federal work study program be leveraged to improve academic and labor outcomes for low-income college students? And this is a study of implementation of federal work across different campuses. You can read the different ones, but you'll see we have some on developing an intervention and understanding how it fits with the theory of change, using technology to try to create greater coordination to improve health and academic outcomes. And then for the use of research evidence, their strategy here is that youth advocacy may be an effective tool to elevate what we know about preventing eating disorders. And so this person is an expert on eating disorders prevention in that literature, but hadn't worked on connecting the use of that in state policy with youth. And so those are 4 different kinds of studies that we have in that space. I would say, you have to, like you would with a K or NSF career, you balance your ambition with feasibility. It's 5 years, so you have to be ambitious enough, but not so shooting for the moon that reviewers don't believe it's possible to do. Get a good mentor. And then we have examples of proposals that have been successful. These are on our website. And again, they're annotated to say the kinds of things that reviewers valued, including describing the stretches or areas of growth that people proposed, and the mentoring plan. So that's where we sit today, and I welcome any questions. I was told there were going to be a lot of questions. There haven't been many questions.
Well, this is the time everybody's gearing up. That was fantastic. Thank you so much for that. And I really appreciated hearing specifically about how things are changing. You're reacting to the kind of, if you will, marketplace of things that you're getting in, and how you're really moving forward. That was terrific. Let me just open it up. Who has questions for Kim? Well, I'm going to kick it off with one while everybody's being less shy and getting their questions together. I think one of the things that strikes me, Kim, is that the foundation funds a lot of things that are actually quite hard to get funded through NIH. So a wide range of designs, policy questions. I mean, that is very, very hard to get policy research funded through NIH. Can you say a little bit more about how the foundation thinks particularly about policy, and are there aspects about policy that people should think about if they want to submit a policy-focused research program to the foundation?
So we see quite a few, does this policy make a difference, reduce an inequality proposals? And so we see a lot of those, so certainly you can do that. We see very few proposals that focus on the policy implementation process. And, you know, those procedural choices, the tools that exist, the implementation really matters. And so I personally think that policy implementation could be elevated. We just don't see a lot of studies in that space. We do see a few, and they really engage with the literature around administrative burdens, around disrupting status quo, which is hard to do, but through different set of routines or different set of rituals, we just don't see many. And so in the reducing inequality space, I think there's an opportunity there. We did fund one years ago that I think is a good illustration of what I'm talking about, which was trying to understand how well EITC, SNAP, and other policies work for the Hispanic, Latino recipients. And they really looked at the guidance across a bunch of states, and then did a deep dive in 5 states to understand the implementation process. And were able to then, through their own, getting a separate grant, work with the states to change access by changing the implementation process of that policy. So there's big P policy at the federal level, and we do receive some. There's small P policy at the state level, and then there's smaller P within an organization. We see them all, and we welcome them all. I'll give you an example of another policy implementation, which was in the state of Maryland. The state of Maryland had invested in a metric for determine when discipline became racially disproportional. And when they crossed a particular threshold, then it had to have an action plan and implementation. And so the study that we supported was to understand if it worked, that kicking into play an action plan made a difference, and then also what elements of the action plans helped a school reduce disproportionate disciplinary practices. And so that was a different kind of study, but that's within, like kind of within a school district. So we support policy at all different levels.
That's great. Thank you. Other questions?
I'll ask a question. So Kim, and it's getting late in the day. So Kim, I don't see that you funded any research in the area that I work in. Should I just go somewhere else? No, that's a great question. often you don't see it there because no one's applied to us because they don't see it there. And so if you believe it's a fit, then send it our way. I mean, we're having our docket deliberations tomorrow, and there are four proposals that we've never seen before. And I suspect if we had more money, they would actually all be getting funding. I mean, that is the challenge right now, is that we have a lot of amazing proposals and we're working really hard to get other funders to join us, but we're not going to be able to fund everybody that's deserving, but we are going to fund things we've never funded before. And so just because you don't see it in our awarded grants, don't rule yourself out.
That's fantastic to hear. And do you have people have the ability to talk to a project officer there to test
Great
that idea?
question. No.
Okay.
And so
I figured you'd be getting
we're
calls
a
if I didn't
staff
ask.
of 9 in the program. We have 3 program officers and myself. So we don't do calls prior to a solicitation. We just don't have the bandwidth to do it. However, the places is if we come to do a university visit, and we have one scheduled next month or next month, I believe, or April. I don't know when it is. We're coming your way. And so then you can ask us, and we actually do 20-minute slots for as many as you want to fill to meet with teams or individuals, and you can pitch ideas. And so that's an opportunity. And the other place is wherever your professional conferences are. If we're there, just feel free to stop us, reach out before. If you see our name on the program, we're happy to do it. So when we're out and about, we're happy to answer questions. But when we're not, we just don't have the bandwidth to do it.
That's very fair. And we will send around when the date is finalized and we have that information. We will send around a notice about Kim's visit, so everybody has access to that. Don. And then we
I'm
have
going
one
to
question.
answer Colleen's and then Don. Colleen asks, are there opportunities for doctoral students in the dissertation phase? Unfortunately not. We again have limited funding, and you are sometimes, and we've had a couple of people be successful. I have one in my head, a guidance counselor study where they came in with the investigator, with faculty, and you have to work out your own institution what the ordering is, but they were able to secure an officer's research grant as a doctorate, but it wasn't a dissertation award. So, Don?
Yeah, I should know this probably. I feel like a little embarrassed to ask a question like this, but I get a lot of the fellows I mentor are taking promising approaches that don't have a lot of evidence behind them and trying to build confidence that they might work to reduce disparities in some form of pediatric issues. So, for example, a fellow might propose that using remote smartphone technology to reduce disparities in blood pressure screening for adolescents in the greater Boston area. I get the impression that might be too specific and too early. They might have some preliminary data, but they don't have evidence per se. They're trying to build, it's sort of an earlier stage. So is that out of scope?
So great question. And since I asked a question of myself, you should not feel bad about asking any question. So I'm going to answer it in 2 different parts. One on the blood pressure part, that wouldn't fit with us necessarily because it's on the physical health outcome.
Okay.
But on the stage of the evidence building, yes, you're welcome to apply. I would say prior to last year, all through last year too, a very nice niche we had been playing as a complement to the federal government was in this early stage. Like people are presenting theories, they may have done a little bit of data collection to support some aspect of their theory of change, but they want to take that, what I call early stage work, to find further support for a theory of change or challenge it, setting themselves up for the eventual where they might have gone to the federal government. And with our
Mhm.
funding up to $600,000 in the reducing inequality space, we are funding a lot in that space, in just the space. So it's a very appropriate space for
Yeah.
us.
Yeah, so if it were about increasing the confidence and quality of psychological mental health issues around
Sure, then it
having
would
a
be
chronic
fine.
disease,
Yes.
that would be
Yes.
okay. I got this sense that you were really interested in mental health, and but that's so inextricably linked to disease states.
Yes. So
So,
they can put them
okay,
together. Yeah. But the
got
early
it.
evidence stage is a very nice spot for our funding. So we're watching to see what happens as a lot of the federal funding, particularly in the reducing inequality topic spaces, dry up.
Mhm.
How is it going to shift to us? Because with our indirect of 15%, people can carry $1 million study close to the $600,000 limit
Right.
because there's more research dollars. And then second, where are you going to go with your RCT or something? So that hasn't fully played out yet. We are actually going to do a pretty deep dive to we code it all. So we're trying to understand, is what's coming in our door changing? So we can watch to see if what gets funded changing. In every portfolio, and even in what's coming tomorrow, we have studies at each phase of the process, very early in the development stage, middle kind of proof of concept, validation stage, and then some that are a full RCT. And and I'm confident that we'll be funding in each of those phases.
That's fantastic. Well, we are out of time, but I want to take a moment first to thank you for a fantastic session today, but also to you and the foundation for sticking with the issue of inequality. So many of us do work in that space and are so concerned about what's been happening on the federal funding front. So we're very, very grateful for that. Caitlin has a couple of quick announcements before we close out here.
Yes, I just dropped them in the chat. So our next ISWG will be March 17th. Same time as always. We'll have Margaret Giovanetti Ben-Or, who works at the R&D labs here at Brigham and Harvard. And she's going to be talking about the development of implementation science-based toolkits. There's also currently a collaboration board post available. So if you're looking to potentially be an IS collaborator, be sure to check that out. I have the link in there. And then as always, I have our IS consultation services link if anyone needs a consultation.
Thank you, Caitlin. Great to see everybody. Thanks again, Kim. That was fantastic. Really appreciate it. Have a great rest of your week, everybody. Bye.